about how an industry that somehow manages to be both extremely profitable and deeply emotional. Baby formula.
Uh-huh. So here's where things can get a little bit uncomfortable because once you see the patterns of how these big companies shape your health choices, you can't unsee them.
A few years back, emails obtained through Freedom of Information requests showed that Coca-Cola was allegedly trying to build relationships with senior staff at the Centers for Disease Control and Prevention.
They essentially sell empowerment while lobbying against the support that would make the real choice possible. Nestle, especially.
Yo.
I have my eye on you.
Oh. Hello, Globies, and welcome to the World Health Investigation Podcast. My name is Jocelyn.
I'm Edna. We are young global health professionals and your hosts for the World Health Investigation Podcast.
Also known as the WHI, we will be discussing all things global health, unpacking the most controversial health and social issues,
as well as promoting new wave global health development and equity.
On to the juiciest part of the episode.
Today is one of those episodes that could very quietly mess with how you see everything from your grocery shop to your Instagram or TikTok feed. We are talking about commercial determinants of health.
Ooh, commercial. And we're going commercial. So we talk about health like it's all gym memberships, willpower, and calorie counting. But in some ways, a lot of illness actually starts way earlier, like in boardrooms where people in suits decide what's cheap, marketable, and what we consume.
So when we talk about commercial determinants of health, this is basically a fancy global health phrase for how big companies shape people's health, directly or indirectly, positively or negatively. Spoiler alert, it's normally negative.
Usually when someone is living with obesity, diabetes, or cancer, we hear they should be eating better. But that's not always the case, is it?
No, it's not. And when we look at health through the lens of commercial determinants of health, we start to ask, are conditions like cancer, obesity, lifestyle diseases, or profit-driven diseases?
Because the reality is industries like tobacco, alcohol, ultra-processed food, and formula milk don't just sell products. They use marketing, lobbying, political pressure to build environments where unhealthy options are louder and nearly impossible to avoid.
For example, in 2024, Adfree cities in the UK estimated that companies place 6 times more adverts and outlets for unhealthy food in deprived areas than in wealthy ones, which is wild when you think about who gets blamed for bad choices.
That's wild. That is wild. And while high-income countries are finally trying to regulate junk food with taxes and advertising limits, ultra-processed food sales are actually growing fastest in low and middle-income countries, especially across Latin America, Africa, and Southeast Asia.
And on top of that, the WHO estimates that more than 70%, so the majority of all global deaths from non-communicable diseases now happen in low and middle-income countries. So that's heart disease, diabetes, cancer, etc.
So basically, when regulations tighten in one place, companies don't quit. They just pack up the marketing budget and take their harm somewhere else with fewer rules.
So how do corporations actually do all this? So here's where things can get a little bit uncomfortable because once you see the patterns of how these big companies shape your health choices, you can't unsee them.
So I want to just agree with what you're saying because that's where commercial determinants of health really start to show their teeth. These industries tend to aim their products and marketing at people who are already stretched thin emotionally, financially, mentally, and then act surprised when harm follows.
So like we said before, companies will place 6 times more adverts and unhealthy food outlets in deprived areas than in wealthy ones, which, by the way, are also places with higher rates of poor mental health.
So in a way, if you're short of time, money, and mental energy, you're far more likely to grab the cheap, fast, heavily promoted option.
Right. So these industries focus on selling products that are quick, accessible, heavily engineered to feel good at first, and slightly addictive, whether that's fast food, alcohol, gambling apps, or even tobacco.
Speaking of addictive.
So now, instead of owning this setup, these industries also usually pull the same move. They shift the blame back onto the consumer.
Right. So suddenly, it's not this product is designed to hook you. It's you didn't use it responsibly, which is a wild thing to say about something that's literally addictive.
The gambling industry does this a lot, calling people problem gamblers, as if the issue is a personal defect rather than apps built to keep you chasing losses.
And food companies do something similar, pushing calorie counting and personal choice narrative, even though Poor mental health is linked to lower quality diets.
So, in short, they sell harm, then sell the idea that it's your fault for falling for it. Yeah.
Hey, I've been knowing. I've been knowing.
Yeah.
Let's talk about physical space for a second. Because this isn't just online ads, it's neighborhoods.
For example, England's poorest communities have 41% more fast food outlets than the wealthiest ones, right?
Why am I not surprised? And that usually translates into life expectancy. Areas with fewer fast food outlets live around 2 years longer than those surrounded by them.
So, meanwhile, people from racialized communities are also more likely to live in neighborhoods where fast food makes up a bigger share of all food options.
So, very casually, the food environment becomes a health lottery. And guess who keeps winning? The corporations.
Now, whenever governments try to step in, companies suddenly get very concerned about freedom and the economy.
The tobacco industry is a classic example. Despite smoking being a life-threatening addiction, they've argued that regulation is an attack on personal liberty, impossible to enforce, and likely to create black markets, none of which the evidence supports, by the way.
And the gag is, when regulation does happen, it actually doesn't even hurt their profits. That's the thing.
Does it?
No.
It actually doesn't. Now, there was no evidence of lost soft drinks profits after the sugary drinks tax in the UK, and advertising revenue actually went up after London banned junk food ads on public transport.
So, in other words, this whole economic meltdown narrative is just not really true.
Oh.
They're just making that up.
They're just making that up. Ding, ding, ding. Sometimes, though, these companies tell on themselves.
So, way back in the 2000s, there was this whiskey industry case that, rose to popularity. And someone there openly admitted, quote, as the case in many post-mature markets, whiskey brands are very reliant on a small number of heavy, increasingly aging consumers to provide the majority of volume. In the longer term, we had to attract more younger drinkers, the heavy-using loyalists of tomorrow.
Or this gem from PepsiCo, CEO in a 2010 interview, if all customers exercise did what they had to do, the problem of obesity wouldn't exist.
Which honestly is a masterclass in pretending structural harm is just a personal character flaw.
Or this quote from gambling industry executive who said, problem gambling is complex and is about the person, not the specific product.
So, you see, in short, commercial determinants of health aren't subtle. They rely on targeting vulnerability, blaming individuals, muddying evidence, and crying economic doom whenever regulation shows up.
And once you clock that pattern, it becomes very hard to keep pretending this is all about personal choice.
Yeah. So you know what? Just to bring this home globally, let's look at some concrete examples. Let's look at some real world things that these companies have been doing. Let's spill the tea. We'll start with sugar. Because this one is wild and it kind of has a sinister aspect to it.
Yeah. A few years back, emails obtained through Freedom of Information requests showed that Coca-Cola was allegedly trying to build relationships with senior staff at the Centers for Disease Control and Prevention.
And just to be clear, this wasn't like a casual, hey bestie, email chain. This was Coca-Cola actively trying to shape how obesity and diet were being talked about at one of the most influential public health bodies in the world.
And in fact, Coca-Cola executives arranged private dinners with the CDC officials and followed up by sharing research how they funded on low and no-calorie beverages. The email showed Coca-Cola encouraging the CDC to shift attention away from sugar-sweetened drinks and instead focus on things like physical activity or individual behavior.
So rather than maybe sugar everywhere is a problem, it becomes, have you tried jogging more?
And it didn't stop there. When the World Health Organization came out supporting limits on sugary drinks and recommending sugar taxes, Coca-Cola executives literally emailed CDC contacts asking how to influence the WHO.
One exec actually even complained that the WHO didn't want to work with the industry and suggested something must be done.
Which is wild. Because the WHO not working with soda companies on sugar publicly is kind of the whole point.
So this is, the playbook, influencing science and policy without ever showing up as the villains, Allegedly.
Allegedly, of course. course.
Allegedly.
But we see you.
We are seeing.
We are seeing
We are
you.
looking.
Now, selling anxiety as a product. That's what it is. Because let's talk about how an industry that somehow manages to be both extremely profitable and deeply emotional. Baby formula.
Uh-huh. A major series from the Lancet laid this out very clearly. The global formula milk industry is worth over $55 billion a year, and its profits mostly flow to companies based in high-income countries.
Meanwhile, the health, social, and emotional harms land hardest in low and middle income countries.
And the marketing strategy here is honestly brutal in its precision.
Now, these formula companies target parents at their most vulnerable, sleep deprived, anxious, scrolling at 3 a.m., and suggest that double baby behavior like crying or disrupted sleep means breast milk isn't enough.
Then they just slide in with the solution. A specialized formula that promises better sleep, calmer babies, even improved brain development.
We see you. Labels use words like brain, neuro, IQ, even though studies show no evidence that these ingredients improve long-term cognition.
So it's poor science wrapped up in comforting slogans.
We're getting there.
I see you.
And when breastfeeding advocates push back, the industry reframes them as judgmental or anti-feminist, positioning formula as the empowering modern choice.
All while ignoring the fact that 500 million working women globally don't have adequate maternity leave, which makes breastfeeding genuinely difficult. They essentially sell empowerment while lobbying against the support that would make the real choice possible. Nestle especially.
Yo.
I have my eye on you.
Oh,
I have my eye. We could do a whole episode on Nestle alone. I'm watching you.
we're watching.
Allegedly. We just gotta say that.
Obviously, it's always alleged.
You know? So whether it's soda or formula, the pattern is basically the same.
Create the problem, soften the science, sell the solution, and then blame the individual if it goes wrong.
You know? And then call it consumer choice.
So what do?
Good question, since we are the ones to blame.
Right?
It was all our personal choice. So let's talk about the solutions. Because when we talk about commercial determinants of health, we're basically saying a lot of the things shaping health are coming from boardrooms, not biology.
Okay, like your environment, what you eat, where you live, what you're exposed to every day is often influenced by companies trying to sell you something.
So one thing that actually works, pricing policies. Increasing the price of products that harm our health, like alcohol or ultra-processed foods, through things like minimum unit pricing or sugary drink taxes.
Period. And this can reduce consumption and encourages companies to reformulate their products. Basically, if profits are risky, suddenly that low sugar version appears overnight.
And the money raised from these policies can then be reinvested into public health. So we're talking about smoking cessation programs, subsidized gyms, safer cycling lanes, public parks, healthier school meals, all the things that make healthy choices easier to make. It's very much you contributed to the problem, now contribute to the solution approach.
Tell them. And another big win is limiting how much influence unhealthy industries have over health policies. Because if a company profits from selling you something addictive, maybe they shouldn't also be helping decide what addiction prevention looks like.
But, and this is important, it's not just about restricting harmful companies, it's also about supporting the ones doing the right thing. This is where positive commercial determinants of health can come in.
Yeah. And think social enterprises. So businesses that are designed to make profits, yes, but also to improve health and well-being. For example, companies that create affordable, healthy ready meals in low-income communities.
Or organizations that provide employment opportunities for people with lived experience of mental health problems, which we know is huge for recovery and well-being.
And then we also have social enterprises designing active travel schemes like community bike sharing programs or creating affordable green housing that improves air quality and reduces overcrowding.
And the evidence shows that secure jobs, fair wages, and safe working environments are all linked to better mental health outcomes.
Yeah.
So when businesses invest in the right things like flexible working, living wages, or supportive workplaces, that's actually a public health intervention.
Which is why we need our governments to also step in with the basics, like increasing minimum wage in line with inflation, supporting people with mental health conditions into stable employment.
So the real goal here is shifting from a system where companies profit from poor health to one where promoting health is actually good for business.
Business for us, all of us. Now, healthy people, healthy profits. Now, that's a business model that we can support.
I think so too. So that does it for this episode, Globies. Again, thank you so much for listening, making it all the way to the end. You're a real one.
You're a real one. Make sure to like, comment, subscribe. Because apparently, I just want to say that about 90% of you have not subscribed to our YouTube channel.
90.
A good 90%.
Wow.
Can I know my offense?
Oh.
Can I know our offense?
What do we do?
What did we do?
What did we do?
What did we do? Do you not enjoy? If you've made it this far, you must be enjoying the episode.
You know?
So please, I beg, go and comment now. Go and like, go subscribe, support us because it helps us grow and it also encourages us. At WHI_podcast on Instagram, on TikTok. If YouTube is World Health Investigation. You see we have a new logo. Please make sure to support us.
Yes. Thank you so much for listening. And tune into the next episode.
Period. Bye.